Welcome back to the Real News Network, joined again by Richard Wolff from New York City. He teaches political economy at the New School in New York. Thanks again for joining us, Richard.
Thanks for the invitation.
So President Obama's on the road. He's speaking in town halls and television shows and press conferences about healthcare reform. Some newspapers are saying healthcare reform's dead and healthcare reform's in crisis. What's your take? What is the state of President Obama's campaign?
Well, I think he's beginning to look a little desperate. I think he thought, and his supporters thought, that they had more backing for what they had hoped to do than they apparently do. Or maybe the better way to put it is that the opposition, mounted by hospitals and doctors and drug companies and all those with long established vested interests in our health system, they're determined either to make sure that the program the president wants doesn't hurt them, or to make money out of it, or at least to make sure that if they can't be guaranteed making money out of it, that nothing happens. And it's now a touch and go question what kind of a health reform we will actually have.
We have a story on our website. It's a speech that John Conyers gave at the National Press Club, Congressman Conyers, and he calls it the Rahm factor. That Rahm Emanuel, Barack Obama's chief of staff, he just wants a deal. He just wants something signed, because not to have something signed could jeopardize the next presidential election and the coming congressional elections. And Emanuel doesn't care much anymore what that bill is.
Yeah, it does look, I mean, I don't know whether that's true or not, but it does look as though with each passing couple of days, something else that could have been, should have been, might have been part of health reform is allowed to disappear and be pushed off the table. I think the most important thing for people to keep in mind as this process plays out are some basic facts. The United States spends more on health care than any other advanced country. There's nobody even close. And the results of our health care put us way down in the list. That is, many countries who spend less on health care have much better health results in terms of how long people live, in terms of the number of children that are born that live to a ripe old age, the level of care that is needed in a hospital, and so on. So Americans used to be proud of saying, if we're not producing the best quality at the lowest price, we should go and find out who's doing that and replicate their experience. It's a little bit like General Motors used to go and work with Toyota in the years ago to try, which they didn't manage to do, but at least they tried to learn from companies that were producing better cars at lower price. Now the point here is we know exactly where to go to find out how to produce better quality healthcare at a lower price. We could go to England or France or Sweden or Canada, and there we would learn much of what to do. But that's off the table. Not only is the single payer out of the picture, but we're not willing to change or challenge the hospitals, doctors, drug companies, and insurers who have put together this badly functioning health system. And if all we're going to do is add on a little more insurance program, charging huge premiums to pay for this overpriced system, then we're going to have very, very meager reform. And now they're even sniping at how many of the 50 million uninsured people will be covered, how much they will be required to pay out of their income.
So the Obama administration would answer you, even Obama had said that single payer, if we're starting from scratch, is the best system. But he's made it clear that there just weren't the votes for single payer, and that some kind of public plan in competition with private plans was the only thing achievable. And now they probably say, well, look at the trouble we're having even with that. Imagine the trouble we would have had with single payer.
The answer to that is not about healthcare. The answer to that is about politics. When a politician says the votes aren't there, my anger begins to rise. Votes are not either there or not there. You make the votes happen. You mobilize, you organize. Either you do that or you accept the status quo. What's going on now is there's a lot of effort being made, a great deal of effort, by insurance companies, doctors' organizations, drug companies, hospitals. They are filling the airwaves with their advertisements. They are talking to their people. They're contacting their local politicians. They are waging, with enormous amounts of money, a national campaign. That would have to be done by the supporters of healthcare on a comparable scale, led by the president. He ought to be out there building the momentum that would make it impossible for politicians not to go along, to really attack and say such and such a politician is stopping healthcare reform that we need for everyone. Without that kind of campaign, then the outcome is already foretold. He will have to collapse in the face of the votes that are there, but it's not because they're there in some fixed cement stone. They're there because the other side, the opponents of any real meaningful reform, are out there and have been out there for a long time, creating wild ideas, fear of socialized medicine, the doctor will be chosen by the government, and all of these obvious scare tactics, which the mass of people in the developed part of the world, all around us, all our allies, reject that.
President Obama seems to be reluctant, scared, not willing to go into what would be called traditionally an extra-parliamentary form of fighting. In other words, ask 5-10 million people to meet him in front of Congress in a couple of weeks and tell Congress we want real health care reform. He won't get outside of politics as usual.
That's clearly been his plan. And look, you can understand it. Being a player and playing by the political rules has made a relatively young man with relatively little experience the president of the United States. One could understand that he is constitutionally unlikely to break the mold. The problem is he's now caught in a contradiction. If he's going to play by the rules, if he's going to allow his opponents to do all the campaigning in the mass way that they're doing across the country, then he risks playing by the rules and being destroyed by those rules. There are increasing numbers of people saying that a president who promised openness but won't show us the photos of Abu Ghraib and Guantanamo, a president who promised to get us out of these wars and isn't doing it, and now a president who has retreated and said he's going to at least get us a health care reform, even though he has given up on the union organizing reform. Too many things that he can't get done, and you're going back to that very dangerous for the Democratic Party view of Americans, which is either that party doesn't want to or that party cannot make the kinds of changes it claimed to represent over and against the Republicans.
He doesn't seem to be willing to go into real struggle with the right wing of his own party.
No, nor with a real struggle with the Republicans. It's all verbal, and then lots of dealings and wheelings. And I do think it's very, very scary to hear talk from President Obama and his supporters about we just don't have the votes. You have to create that support. You cannot wait for it. Bush and Cheney didn't have support to go to Iraq. They got that through the good luck, or whatever it was, of 9/11. They were able to produce the votes to get their program through. President Obama has to do something comparable, obviously not a 9/11, but some comparable mass political mobilizing event, or else he will not be able to get through what he did, even the way Bush and Cheney got through what they wanted.
Thanks very much for joining us, Richard.
Thanks for the invitation.
And thank you for joining us on the Real News Network. And once again, the donate button's up there, and we need you to do that if we're going to do this. Bye-bye.